Bismillahirrahmanirrahim. Assalamu alaikum. In the video, I can see that there is a 8 months old baby looking unwell and alert in hospital settings. The baby is connected to oxygen cannula and monitored in situ, and he has a barking cough with inspiratory stridor is present, and I can appreciate there is respiratory distress with fast breathing. I would like to count the respiratory rate, and there is intercostal subcostal recession, but I can't appreciate any cyanosis there. And so my differential diagnosis depends upon it is acute or chronic. If it is acute, so it may be acute laryngobronchitis, bacterial tracheitis, epiglottitis, foreign body anaphylaxis. And if it is chronic, it may be laryngomalacia, tracheomalacia, laryngeal wave, laryngeal cyst, laryngeal papilloma, laryngeal hemangioma, and vocal cord paralysis. And if it is laryngotracheobronchitis, that means it is Croup. What history you would like to take? So history is onset, course and duration, any factor that increase, how it relieve, and is there any presiding illness present or not, any kind of fever, any weight loss, and any drooling present or not, any bluish coloration of the skin or tongue is present or not, and is there any what is the feeding history, and he had urine output, any detailed perinatal history, any history of contact with COVID patient. And on examination, airway, breathing, circulation, vital sign, SpO2, any cyanosis present or not, and anthropometry of this child, and respiratory system examination. And investigation, we will, if it's a case of Croup, we will not do any investigation. If the diagnosis is uncertain, then we will involve our consultant. And management, first of all, we will divide the Croup mild, moderate or severe. Mild, if there is barking cough and stridor or is present only in the wrist. Moderate is there is intermittent stridor at wrist, and severe when the in case of mild Croup, there is barking cough, mild stridor, and which is not present at wrist. In intermittent, there is intermittent stridor at wrist, and severe there is stridor on wrist, and there is severe respiratory distress, SpO2 less than 92%, and cyanosis is present, patient is restless. And how to manage if the case is mild to moderate? So analgesia, ibuprofen or paracetamol for relieving the discomfort, and educate fluid intake and reassurance, and gifted on the Croup, and giving oral dexamethasone. You can discharge the child, or we can observe for 4 hours if it is moderate Croup, and we can give oral dexa after 12 hours or prednisolone single dose. And but if it is the severe Croup, then admit the child, or measures to take and keep the parents and the child calm and quiet, and giving oxygen by the face oxygen and nasal masks, not try to making the child crying, and giving oral dexamethasone if not able to take, so nebulous budesonide, and yes, and adrenaline, nebulous adrenaline, if the condition is not in, and here we have to involve our consultant. And if there is uncertainty that the course of dexamethasone or adrenaline is not work properly, so we will involve ENT and anesthetics, and we will transfer the child to PICU. and discharge and follow up. Discharge with lifted of group and give the safety rating red flag sign. If there is persistent fever, biphasic wheeze, any convulsion, any cyanosis, any severe respiratory distress, drooling present, so to come back immediately. In case there is no follow up, immediate in case of group. Thank you. Assalamu alaikum.